what we need to achieve out of the industrial action to actually put an end to it is for the Secretary of State to come back round the table and put a better offer on the table for the hundreds of thousands of nursing staff that are taking industrial action today, but also that voted in this ballot.
Steve Barclay, the Health Minister, says that the strikes today are premature and also disrespectful to the unions who are getting around the table and talking tomorrow.
There's certainly no disrespect being shown from our nursing staff. I can say that categorically. So I would ask the Secretary of State not to be disrespectful to those hundreds of thousands of nursing staff that have participated in this ballot and that are losing another day's pay today, standing out on picket lines, standing up for a health service that's been totally broken by this government. An NHS in crisis, 7 million plus people on waiting lists, all very well rehearsed. So how are we going to address all of those issues? How are we going to address the tens of thousands of vacant posts that we've got in England? And if we don't, then we will continue with serious risk to patient safety. We'll continue with those millions of people sitting on waiting lists, and we will never get the backlog sorted. So it really is incumbent on this Secretary of State to get round this table immediately with myself and the Royal College of Nursing and put more money and let our nursing staff get back to do what they want to do, and that is care for their patients.
What's happening tomorrow? We know that the NHS Staff Council are going to discuss this 5% pay offer. We spoke to Matthew Taylor from the NHS Confederation an hour ago. He said it is now time, he feels, for the nurses to accept the deal.
Well, also listen to the rest of Matthew's interview and his very measured approach. And what he said was that there would be a decision made tomorrow. But he did say very clearly that will it address the 120,000 vacant posts that we've got within the NHS, of which 47,000 of those are nursing staff. And I didn't hear him say that that pay offer would actually address this and that that was the end to the crisis we've got in the health service, because it won't be. It definitely will not be. We need to pay nurses decently. And what we need to see now is the NHS standing up and being very clear with government that they need to address the nursing crisis that they've got right throughout the NHS. And until they do so, our nurses, unfortunately, will be left with no option but to continue with the action that they are taking. We intend to reballot our members again mid-May with a closing date probably mid-June for further action. That could see our nursing staff being pushed out on picket lines right up until Christmas. But we don't want to do that. Not a single nurse you will meet on a picket line today wants to do that. They want to get back into their work. They're selfless people, but we do need to bring this health service back from the brink.
What the idea of nurses striking all the way up until Christmas, you've been able to take the public with you so far. Do you not fear that that will change?
Look, the public of England are very tuned in. And I want to say my sincere thanks to them again this morning. Every poll that's carried out by different organisations show that nursing and the nursing profession is the most trusted group right throughout the UK. And unfortunately, I do have to say this, the least trusted people are holding them back with low pay and poor working conditions. And when they hold nursing back, they hold patients back and they hold the health service back. So let's now get this sorted, get pay talks started again and do the decent thing for our profession. But I want to thank the public because we have stood by our public through thick and thin, right throughout the pandemic and long before it. And now our public are standing by us. We are the same side of the one coin, and we'll continue to stand by our patients.
You've pegged your demands to inflation. You know, you're obviously going to have to reballot members. This is going to take a while. Inflation's already starting to come down. Even it may go up, but most analysts say that it is going to come down. Will this then reduce your demands?
Well, I think you've just answered that question. You said it may go up, but it may come down. And the pay offer that's on the table for our nursing staff's 5%, half of what inflation is sitting at this point in time. But what we see is that the cost of living and the cost of goods has certainly not come down. And if you speak to any nurse today or any other day, they are seriously struggling. They're desperate to be able to pay their bills, to be able to pay their rent, to be able to pay their child minding and to put food on the table, but also to be able to travel to work, which is costing more and more for them. So we are really struggling to get people to work in large cities such as London, because the costs are just so high. Our nurses can't afford to live in the city and they have to travel for hours in and hours out after a very long shift. So this has to change by a better pay offer so that we can retain the most brilliant nurses that we've got in England at this time. But we need to be able to attract more people into the profession. And the only way we'll do that is by paying them a decent wage.